Hello and welcome. This is Health and Wellbeing. I am Lois Apasambu. Cancer is a serious, life-threatening illness that affects millions of people around the world. Nigeria has one of the highest cancer mortality rates in the world, with approximately 4 out of 5 cases resulting in death. This is according to the Global Cancer Observatory. Most people's fear of cancer is often rooted in the fact that it is a potentially life-threatening illness. However, with efficient care and management, cancer patients can live long and have fulfilling lives and can also be cured. Today on the program, we will be discussing cancer care and hope for cancer patients. I took a short survey asking people what they think about cancer, and this is what they had to say.
When I hear that someone has cancer, what comes to my mind first is, will the person survive it? Because we were made to believe that cancer is death sentence. But as a result of this work and awareness today, I believe that, and I was educated that cancer is preventable, cancer is curable.
Really, a lot of times when I hear cancer, I just want to say they are fighting for their life or fighting for survival all the time when you hear cancer.
Actually, me, when I hear cancer, all that comes to my mind is just that cancer is a deadly disease. So one has to be very careful, like proper checking of your health helps a lot to eradicate it.
It's good that some people know that cancer is not a death sentence. Because of the feelings of uncertainty, powerlessness, and lack of control over one's fate associated to cancer, a lot of people diagnosed with cancer feel it is a death sentence. However, there are people who were diagnosed but have been cured and now live normal lives. Gloria Orji is the president of Network of People Impacted by Cancer in Nigeria, and she shares her experience living with cancer and overcoming it.
My name is Gloria Ojinwajiogu. I am the president of Network of People Impacted by Cancer in Nigeria. I was diagnosed of breast cancer in 2010. I do my breast self-exam whenever I'm having my bath, and I discovered the lump myself. And when I discovered it, I told my girlfriend. She said, well, let's just go to the hospital and check it out. So we did, and it was cancerous. And the treatment, it was a private hospital anyway. I was now referred to National Hospital to proceed with my treatment. I want to say something. I was careful with a lot of distractions from people that love you, from friends that told me, go to see a man of God, go for prayers. Some told me, don't go for chemotherapy. Some believe that nobody survives cancer treatment. But I guess by God's grace, I have proved them wrong, because I am here today. And so don't be afraid. Yes, the treatment is terrible. In fact, if I use terrible, is an understatement, because it's practically, already for the fact you have cancer, you are already emotionally down. Personally, I was depressed. I stopped living. I just believed that there was no need to live. There was no need to plan. If you're planning, it may not really materialize. So why plan? But when I started my treatment, I don't just go to hospital. I first of all go to my church and pray. I pray to get the strength to pull through. And when I got there, I started my treatment. The horrible side effects of chemotherapy. My hair fell off. I was throwing up, my complexion, my nails. At the time, some nails fell off, some changed colors, And there's always this, sometimes you're so tired, you can't even get up from bed. Sometimes you throw up to the extent you don't even want to leave the bathroom. So it was horrible. And But after it, everything came back almost to normal. So don't be scared to go for cancer treatment. Just tell yourself that you're going to fight it, because it is a battle. And when you fight it by God's grace, you will win. So don't be scared. Well, I need to tell us out there, nobody knows your body more than you. So when something that wasn't there comes, you should know. And I think maybe sometimes we are careless with our system. Some of us don't even know what our body is. Please know your body. Whenever you know your body, you know when something starts being wrong. And early detection, yes, not just early detection and early treatment. So when you catch it early, treat it early. It's not cheap, it's very expensive, but try your best possible and you will be fine. So I believe that when you catch it early, it is cheaper to treat. It may still be the same stress. No, I don't think it's the same stress, because I wasn't really in pain from cancer. Rather, I was in pain from the treatment. So all the experiences I had was majorly from the treatment. And after that, I discovered that in the course of my treatment, a lot of patients have the problem of opening up. They are scared, but they cannot say it. Sometimes they probably want to be strong for others, but no one is strong for them. And from there, we got talking, and Project Pink Blue, approached me at one time for an outreach so that we can talk to people to come for screenings and stuff like that. And from there, we were able to meet other cancer patients, and I started talking to them. And so we needed to come together as a body. So in 2017, we formed the first cancer support group in Abuja, called Abuja Breast Cancer Support Group. We met every month, and gradually other patients with other forms of cancer were like, how come you guys are doing only breast? Does it mean that we shouldn't be among, So we now had to expand it, and that became our umbrella body, the network of people impacted by cancer in Nigeria. So when we started, we were just about 7 members, but now we have over 100 members. And what we do is that we meet, we advocate. It's majorly advocacy for better cancer care in Nigeria. And we've been able to, we went to National Health Insurance Scheme, we met the executive director, and our advocacy to him made some chemo drugs, radiotherapy to be included into the insurance. Initially, it wasn't there. And with the Health Federation of Nigeria, we took our advocacy to the National Assembly, and that was in 2019, where the legislatures agreed and appropriated, as we speak, over 1.4 billion has been appropriated for cancer care for indigent cancer patients. So we do a lot of advocacy. When we go to hospital, we talk to fellow patients. We tell them how to live their life. We tell them that there is life within and after cancer. And so we don't need to give up on ourselves. We need to be strong. We need to keep on fighting until we defeat that scourge called cancer.
My experience, I can tell you, was not palatable at all. It was a bitter experience. I was diagnosed in September 2016, not in Nigeria, but in India. Because I ran all the whole tests in Nigeria at that time, they were not seeing anything. But as soon as I got to India, I was diagnosed of cancer of the Hodgkin lymphoma. That's the name of the cancer I suffered. And it's related to blood too. Yes. And it was just God. It was just God, because I was already at the last stage of the cancer before I got to India, but God helped me. And with the help of Transcorp Hilton, where I worked before, this very Transcorp Hilton, with helping me to spend that money for treatment with God by my side, so I was healed. I didn't thought of cancer at all. it's none of my thinking at all. But the way it was going, if you see me, you think, everyone would think you are HIV positive. I was losing weight, I was losing blood, my legs were swollen, my tummy was swollen. In fact, I was pooping anyhow. Even when I was going to India, I never thought it was still cancer. Not until I got to India, I was diagnosed and they saw cancer in it. There are two things here. One is God being by your side. The other two is finance. Because cancer treatment requires lots of money. And if God is not by your side, even when you spend, some don't survive. But you need to spend first. You can't just sit and say, God help me. No, you need to go for the treatment and you now ask God to help you. So finance was one thing that cancer patients are asking of. Chemotherapy is the drug for cancer. So if you are a cancer patient, get your mind prepared that you must take chemo. You must take chemo. Though chemo, it's very strong. But another thing that kills in cancer is the fear of cancer. Once you have fear that, oh, I have cancer, that if you're not careful, that fear can just make you to go down straight. So you must put yourself together and take that chemo. And again, I was 44 when I took chemotherapy. Then the doctor said my immune system was strong enough to fight back. So I think it has to do with age. If I was like 60, I don't know, but chemo is very strong. But chemo is the medicine for cancer. So you have to take chemotherapy. You have to go through chemotherapy. It's very important, whether it kills or it doesn't kill, but you must take it. That wipes cancer away. The way you eat, what you take in, it's very important. This cancer feeds on what we eat. So, but if you avoid what they don't like, they shrink naturally inside of them. So when I got back after getting the lectures from India, I had to adjust my food. But then I can tell it's very expensive. Even this is my 7th year of cancer, but I tell you, I still maintain my diet. Because sometimes, God forbid, it could surface again. When you start eating those things that you're not supposed to eat. I'm not a drinking type, I don't smoke, but I tell people, avoid alcohol, avoid cigarettes, eat a diet that is balancing, do you understand? And stay away from, I must drink. If I don't drink today, I'm not going to stay. If I don't smoke today, all of that can make cancer grow inside of you. But when you deny them what they want as they're in your system, they will die naturally. And again, I can tell people, exercise is another thing that we must take care of. Exercise, because they don't like it at all. Once you exercise your body, you're stressing them and they will die. So my lifestyle changed when I got back from India. One, by my intake, exercise. I left, like if I was even drinking before I left, all of that, because I need to survive. Nobody wants to die. So if I know this, I will do that, I will do to keep my life. For me, I don't have any choice than to do it. So lifestyle is very important. Diet is very important. What you take inside of you is the key thing itself. My kids, I think, by His grace, we are doing our best to make sure they get a balanced diet, because you need to start from now. Because children have cancer too. Do you understand? So you need to start balancing their meals from now. Yes, that's basically for now, for kids. That's what I do with my kids. I have two. I have a boy and a girl. We, the ambassador, we go to talk to give people courage, to let them know that if we can survive, you can survive. Because like I said, fear is the one thing again that kills. When you have cancer, the next thing you say, oh, will I survive? But when you see people like us, look at me now, if I don't tell you I have cancer, you will not believe. Do you understand? But when you see somebody like me, you have courage that, oh, this man had cancer and he survived. Hey, I can survive. That confidence will bring you back to life. So we go to hospitals again, like a national hospital especially. We visit patients and we tell them, don't worry. Just hold your God tight and have confidence. Take fear away. You will make it. If we can make it, you will make it.
From the survivor's experience, we know that cancer is not a death sentence. With the right care and treatment, you can live a long and fulfilling life. Well, today on the program, we're being joined by Dr. Chinedu Arua, a radiation and clinical oncologist with the National Hospital Abuja and also a senior lecturer with the University of Abuja. You're welcome to the program, sir.
Thank you, dear Lois.
And
Nice to meet you again.
Yeah, and it's nice having you once again on the
I'll say
program.
Happy New Year.
Well, thank you very much for joining us on the program today. We sincerely appreciate your presence. Now, let's talk about cancer. Basically, I'd like us to talk about cancer care, cancer treatment, and for people that have cancer to know that there's actually hope for them even if they've been diagnosed with cancer. But before we hit it off that way, I'd just like you to tell us in layman's words, just breaking it down, what is cancer?
Okay, thank you for your question. Most often, people ask us, even in the clinic, what is cancer? What is cancer? Even in the public, what is cancer? In a general way, I would describe it as a group of cells that don't have any control of the body mechanism and continue to grow endlessly and purposelessly and has no function to the body. And that results to death if not taken care of.
So what would be like known causes of cancer?
There are multiple causes of cancer, and sometimes the cause of cancer is unknown. It can just start to develop spontaneously in a person that is just well. But sometimes the cause of cancer is hereditary. So we can say that 80% of cancers are sporadic, that it just develops spontaneously in a well individual that does not have any risk factor. Then some cases, like 10 to 15% can be hereditary. It can be inherited from the parents and close relatives and the rest of them.
Okay. Now, this thing that you say, I see that there are risk factors. Yes. Now, I know you talk about hereditary, and then sometimes it just happens, you know. But what can people do, especially for people? How would you know that you are at potential risk?
Yes. When you talk about risk factors, we are now talking about certain things that you do that are potentiate the likelihood of developing cancer. That if you're able to, part of the preventive mechanism is that you make sure that you don't do those things that are going to potentiate or lead to development of cancer. So when we look at lifestyle of each patient, when we take what we call medical history, we find out that certain things are related to their having cancer or presenting with cancer. So like people that develop head and neck cancer, cancer that occur in the head and the neck, we find that most of them take a lot of alcohol, they do smoke, they live in a polluted environment, then sometimes they're exposed to radiation, some are exposed to excessive sunlight, then some known to have been be treated of one disease or other that have to relate to head and neck. So you can see that if those people, if they're able to desist from smoking, then taking alcohol, exposure to a polluted environment, that the chances of developing head and neck cancers is very low. Then you now talk about women that got exposed to human papillomavirus that develop commonly cervical cancer, which we know is one of the most preventable cancers in the world, and which even World Health is working towards its elimination by 2030. That women who or men who are exposed to this human papillomavirus tend to develop some certain kind of cancer. Like in female, we have cervical cancer. In male, we have penile cancer. We have equally genital wax, which is a benign disease, but it looks, if you look at it, if you picture it, it looks like a cancer because of the fulminant appearance of the disease. So you can see that patients that have multiple sexual partners, especially a woman that have multiple sexual partners, the chances of being exposed to this virus is common. Then you talk about liver cancer, those who eat a lot of peas, and those who did not receive hepatitis B virus infection vaccines, who take a lot of alcohol, who are using these unsterilized needles, who are drug addicts, and rest of them, that or on-screen blood transfusion, that most of them can develop hepatitis virus infection, which can lead over some time into liver cirrhosis, and which, if not well managed, it can transform into hepatocellular carcinoma, the cancer of the liver. So all this is a multiple, is like going into a big market. So it depends on which cancer we are looking at. If you are looking at a woman like we are talking about breast cancer, which is most common, we look at nulliparity, a woman not having, having baby maybe above 30 years of age, then because as their age is increasing, the risk of developing breast cancer is equally increasing. Then you have patient who is on hormonal therapy or oral contraceptives. So the chance of developing breast cancer is equally high. Then those who have exposed to radiation in one way or the other during their childhood or so on, they may have some chances of developing breast cancer. So there's a multiple cases, but you should equally know that not all swelling or all lump or all things we see on the body that is cancerous. Some are non-cancerous, but because you have to go to lab, the doctor have to take a sample from the tissue, which we call biopsy, then take it to the lab. We have to examine it under microscope, and a pathologist will now tell you whether this one is cancerous or not. So the basis is that when you notice anything abnormal in the body, see a doctor, then the doctor will go further to evaluate you. Then if it requires taking a sample from the swelling or from anything that is there, then for further evaluation, it's now left for doctor to know that.
You know, when you said it's good to note that not all swelling or not all lump is cancerous, that even brings us back to our message, you know, like so many people are so scared of cancer. The moment there is something, okay, we feel that there's something, we feel there's a lump in your breast, it may be cancerous, it may not be, we would have to take it to the lab. Especially for women, quite a lot of them just, you know, they begin to fidget because they're just scared of what if it's cancer, what if it's cancer. And that's because many people just feel like once I get cancer, it's not curable. Once I get cancer, I'm going to die. So people just say, once I get cancer, like that's just it. I'm beginning to start battling for my life. Even before, for some people that's even diagnosed early, even before it gets to the late stage, they already begin to battle for their life, even when it is not that bad, you know. So how can people get to that point where they understand that having cancer is not necessarily a death sentence?
Yes, that is a very good question, dear Laurie. Actually, the problem you have is the information, the amount of information you have enables you to deal with a particular problem. So most often, it's because these are people who are actually afraid of a lump in their breast or whatever it is, because they don't have enough information or they have not met experts who can now allay their fears. And I want to tell you that cancer is now becoming very, very curable compared to previous years because of advancement in technology, advancement in knowledge, advancement in a lot of areas, advancement in ICT and a whole lot of experts. Like I would say that initially we can count about 10 radiation and clinical oncologists in Nigeria, but now we are up to 80 and above, and more are coming on board. So it means that for you that have a lump, you don't need to label yourself that this is the end of the story. Not at all. Even cancer now, we have a lot of survivors everywhere. You just mentioned one Gloria. Gloria was one of our patients, so we managed her. So I'm happy that she's doing a good job by disseminating information about that people can beat this cancer and survive. We have a lot of survivors, but there's one thing about our system, let me call it socio-cultural milieu, whereby people do not come out to talk about their experience so that others will learn how they beat cancer, how they survive. There's a lot of people we have treated and who are alive today, 10 years, 20 years, 15 years, and going. And they are living their normal life. Some of them, we have even lost track of their fellowship. So following them up. So, but the main thing is that when you have this problem, do not fidget. Do not feel that that's the end of the life. The whole thing is about early detection and diagnosis. Early detection is that once you come early enough, the experts will see you, the doctors will see you, and able to take all the necessary measures to ensure that you are cured on time. But most cases that you see that appear, I have to say that cancer is not curable because people present very late. So cancer has what you call stages. Stage 0, 1, 2, 3, 4. The higher the stage, the worse the prognosis. So if a patient presents at stage 1 the chances that the patient will be cured is quite very high. If the patient is presenting at stage 4, the chances that the cancer has spread to other parts of the body becomes very common. And at that point, we're no longer talking about curing the patient, we are now talking about palliative treatment. And that is one of the things that we see in our clinic every day. And it has to do with what we call health-seeking behavior. How do people respond to e-health? How do people take their health? People go to mechanic, people take their car to mechanic shop to change oil, to check the battery, to check the brake, to check this, but they never go to hospital for a whole year. They have never been to hospital for a routine check. And even if you travel outside, you see that one of the things that they do for you, that they assign a GP for you, a general practitioner, who is always on your neck to make sure that you are running some routine tests when due, and serves a reminder to you. And if you don't do that, they are going to serve some papers to you from time to time. At a point, they have to win you off this National Health Insurance. And once you are off there, when you fall sick, you find out that health is wealth.
True, health is wealth. So now let's talk about what people can do to reduce their risk factors. There's some people that it may not be hereditary, but there's some people that is hereditary. For some people that is not hereditary, what can they do to reduce the risk? Or even for people that it's hereditary, it's in their bloodline, what can they also do to reduce the risk of coming down with cancer?
Yes, even science have discovered that even those that with hereditary cancer, there's lifestyle modification that reduces the risk. Let us put it this way. Like a patient that the mother, the sister, they had cancer, and she's in obese side. Obesity is one of the triggering factors for maybe, let me call it breast cancer or endometrial cancer. But if you see that the patient is now making sure he's not obese and doing a lot of exercise and taking a good dietary control, you can see that risk that's going to have, she is going to have what we call risk reduction. The chances of getting cancer is now being reduced along the scale. So we can do this risk reduction for equally for spontaneous, those who I said that can occur spontaneously or sporadic. So, and those risk reduction include exercise, good dietary modification, avoiding polluted environment, making sure that from time to time you go for routine health check is mandatory, making sure that at every point in time, some of these screening tests that we do them. So with those things you are doing, you now tend to see that there are going to be a lot of risk reduction, no matter the type of cancer we are talking about.
Well, one thing I always want to talk about when we talk about cancer is sugar-sweetened beverages, what we call soft drinks here. Even though it's not only streamlined to soft drinks, but in this part of the world, we consume a lot of soft drinks, a whole lot. Statistics has shown that. How does this increase our risk, consumption of sugar-sweetened beverages? How does it increase our risk of getting cancer?
Yes, you know, the body has a mechanism of handling sugar, and especially normal, this is what we call natural sugar. Natural sugar is that if you eat normal fufu in local preparation, then the way the glucose goes up, the sugar goes up, it's quite different from when you take a bottle of Coke. When you take a bottle of Coke, the sugar will shoot up quite very high before start coming down. So those preferred food substances has a way of altering the sugar metabolism in the body. That's the way sugar is being handled in the body. So, in other words, they tend to predispose us to developing some diseases that is something like obesity, cardiac problem, diabetes, hypertension, and rest of them. So, what you do is that some of those preferred beverages must be regulated. If you at all you want to take them, you must be regulated so that you don't actually expose yourself to developing some of these diseases that can lead in their own to development of cancer.
Okay, because one of the reasons why I asked is I've been seeing a lot of advocacy now of, okay, let's reduce our intake of sugar. And I think I've seen a video that calculated the amount of sugar that is in, what do they call it, in beverages, and how unhealthy it is. Now, is it about breaking it down? Is it about how the body breaks down the sugar, or is it because it's in high quantity?
Is because it's a preferred and in a high quantity. So the way the body is going to handle it is a little bit a challenge to the body. And there's one thing I want to tell you. A lot of patients have come to us and telling us that they told them not to take anything completely sugar in their diet. I say, the body needs sugar absolutely to function, to generate energy. And even if you are starving, the body must use other substrates. That's protein, fats, to generate glucose in the system.
Yes.
So the sugar is a must in the body. In short, once the sugar is not there in the system, you have taken no carbohydrate that have to be broken down to generate glucose, the body must quickly source for other source of glucose. Otherwise, the patient will not be stable. Either you are fainting or they are rushing you to the hospital.
It's good that you explained this to us, because, you know,
so the baseline is that you must have a balanced diet.
Balanced diet is not that you shouldn't have sugar at all.
No. The body needs sugar. Is a must.
It in moderation.
The body needs sugar. Is a must.
And you know, one of the things about this sugar sweetened beverages, because sometimes it gets addictive. People begin to take it over and over. People take like 5 cans a day, 6 cans a day. That's too much. That's what actually takes it out of moderation. I'd like us to talk about treatments of cancer just before we round it up on the program. You do radiation and also an oncologist as well. And the reason why I like us talking about cancer treatment is because people have a misconception of treatment for cancer. I had a cousin, and may God rest her soul, she's late. She had cancer of the thyroid, and she presented late. So it actually got out of hand, and she started chemo, over time started radiation. It still didn't work, and then she died. And her younger sister was like, you should have known she wouldn't have let her go for radiation. If she had known she wouldn't have let her go for chemo. She feels radiation most especially was what killed her sister, because it was so harsh on her and all of that. And so it makes a lot of people, and because she has had that experience, when she hears that someone has cancer, she goes on to advise the person, don't go for radiation. That's what is going to kill you, you know. And so I just want us to get it out clear. The treatment for cancer, you know, what are the treatments for cancer? I know chemo is one, and I know radiation is one, and they're harsh. But I'd just like you to explain it to us, why people have to go through this kind of treatment and how people can come back after they're well from this treatment.
Okay, thank you, Lois, for this question. The treatment of cancer is multidisciplinary. It's not a issue for only radiation and clinical oncologists, because other disciplinary groups are involved, other specialists are involved. Like we have general surgeons who are equally involved. We have the radiologists who are equally involved. We have the pathologists. We have a lot of people are involved. You have the neurosurgeons. They have, in short, there is a whole complete circle of specialists. But major thing is that not all cancers go through all this treatment of with radiation. I'm a specialist in radiation and clinical oncology. Go through radiation or go through oncological treatment or medical oncology, because there's cancers that's why we're emphasizing on early detection and early presentation. There's cancer that will just end on the surgeon's table. Yes. A cancer that presented very, very early, the surgeon will just do what we call local excision. That's cut it off. After cutting it off, they call it wide local excision. After cutting it off, they leave the patient. Nothing more, nothing else. The patient will be observed, continue doing follow-up for some years, and you see patient, nothing further to be done. Then there's some cancers that have, even if you cut them off, they have propensity of reoccurring. Then we talk about radiotherapy. There's a cancer that now there's chances that it may have moved no longer within the localized area, that it must have moved inside the body system into some parts. So we call it systemic spread. It's moved from one point to the other. Then it requires chemotherapy. So patients should understand that not every case that comes to us requires this radiation and chemotherapy, as the case may be. And some of these treatments have been so modified. We have even moved to the level of what we call targeted therapy, immunotherapy, where you use using the body immune system to engineer healing mechanism or a kind of response to this cancer. We have reached a level whereby a particular treatment will be able to isolate normal tissues and only focus on attacking the cancer cells. So some of these are some of the development that is already in the out there in the space that people now have access to and have increased survival level among cancer patients. So people should not be afraid of some of this treatment, even though they have some of the side effects. But side effects is very, very low compared to its benefits. And most of the people that have their relative who died of cancer, should, if you are able to ask them very well, they will equally tell you that they presented very late in the hospital. Some come at the stage of stage 4 disease, in which case the cancer has spread to a lot of places. Doctors are chasing the cancer from one point to the other, and it has already attacked a lot of major organs, especially the lungs, the liver, the head and neck, and the rest of them. So, and the kidney. So at the end of the day, you find that some of these major organs will normally yield to the cancer. So patient dying of cancer is not necessarily because of the treatment we give. It's mostly because of complication arising from the disease, the stage of the disease, and the extent of the disease, as the case may be.
So let's take about presenting early, because you know there's some of these cancers that you may not necessarily know. You know, maybe it's just feel something. It just feels like, oh, it's just a little pain. And at that time, one may not be able to determine if, should I take it to the doctor to find out if this is cancer, you know? So how do you know at what point, okay, when do I go to check, okay, maybe this could be a cancer, this could be a tumor. How do we know?
Okay, the main thing we discussed, we have talked about people going for routine head shake. If you are going to routine head shake, and you have anything, any abnormal growth in your body in any form, and you see a doctor will be able to there. And we're able to detect or advise you of what next to do. And we have already taken the training a little bit further, because even medical students who are undergraduates now be exposed to detecting cancer at early stage, unlike before. So as a young doctor, you are coming out, you are graduating, a young graduate doctor, we're able to know that a particular disease that is seen is not a normal thing that you need further evaluation. You can do an appropriate referral. Unlike before, where people tend to ignore a growth, and before you know it, they find out that it's cancer and it's already in advanced stage. So I think this knowledge gap is now being narrowed.
It's very encouraging seeing that the knowledge gap is actually being narrowed, especially for doctors that are coming up, you know. And Dr. Samuel, we really thank you for taking our time to be here with us. But before we wrap up on the program, I'd just like you to give a word of advice to the audience out there, most especially as it relates to their lifestyle and reducing their risk of getting cancer.
Okay, well, what I want to tell my audience is that cancer is a curable disease, and the major focus should be early presentation and going for routine head check. Routine head check and lifestyle modification will help in a long way in terms of taming the monster.
Thank you very much, Dr. Ariwa. We sincerely appreciate your presence on the program today.
Thank you, Lois.
Thank you very much.
It's a pleasure. Thank you. Bye-bye.
Well, that's how much we can take on the program. Do remember that cancer is not a death sentence. If you feel any abnormality in your body, please make sure you go see your doctor, and always present yourself for routine checkup. Even if it's just once in a year, it would go a long way. That's how much you can go on the program. Keep it a date with us same time next week. I am Lois Appasambo. Do stay safe.